everybody, it's Lisa Scott here with Fresh Life Connection, your wellness advisor, and my focus is always on self-care. Today I wanted to do a video on how to keep our lungs healthy and open. And yes, this coronavirus is affecting our lungs, but this is something that you can utilize throughout the year, throughout your life. It doesn't have to be focused on this one area. So if you have any kind of lung issues like asthma, or you get bronchitis, pneumonia, you just have cystic fibrosis, there's lots of different ailments that people have, or if you just want to stay healthy and keep your lungs open, which is what I'm doing it for. So I'm going to use a few different modalities. One of them is the Meridian System. If you're not familiar with the meridians, it is what acupuncture and acupressure is based on. So I have a chart here of the meridians, and you can kind of see the complexities of it. There's all these different lines and stuff. That's the front, this is the back. So the meridians and acupuncture, acupressure is basically a college education. But today we're just going to focus on the lung, the large intestine, and the kidney meridian lines, but only part of the kidneys. And what you do is let me back up. What their theory is on acupuncture is that if you have stagnation within any of these meridian lines, that's where disease and ailments and stuff can happen. So what we want to do is to try and keep a good flow going. So when you're utilizing the meridians with acupressure, meaning no needles but just using pressure, that's what we're going to do today. So you want to start at your thumb, on the inside of your thumb, but it's okay to do like a pinching because there's a yin and a yang on all of the different meridians, and the one is the lungs and the opposite would be the large intestine. So what we're going to do is you just want to start and pinch those areas or press on those areas. And I'm going to start us here at where your clavicle meets your shoulder. And if you press in there, you'll feel this soft area that's in there. And all you do is just take that area. You don't have to be precise. Do the whole area that's kind of soft and just press in on it. Now we're going to do both sides, but I'll just start off with one side and then we'll go and do the other. So you can just follow along with me. I am sitting on a dining room chair, and if you want to grab something like that to be able to sit on, I'll give you a couple seconds, be able to go grab that. And if you don't have that right now, but you do want to follow along, that's okay. You can replay this anytime that you want to. So anyhow, we're just going to find where the clavicle bone meets the shoulder, and there's a little soft spot that's in this area, and you're just going to press in on that and just think, ooh, I'm stimulating my lungs. My lungs are getting a lot of energy. When you're using a visualization, when you're doing any kind of body work or anything that you want to manifest, if you can think about that and get a mind movie going at the same time, it's only going to help you to get there faster. So once you've done this, you're going to go out to the shoulder, and then with like a pinching action, like I said, you're just going to be pressing all the way down and turn your palm up. And you're going to go all the way down the thumb side of your arm. And then when you get to the wrist, you're going to find this little soft area that's in the wrist, and you're just going to stop there and do that. And then you're going to continue on down the thumb. And again, you don't have to be precise about this. And to follow up with the large intestine, you're going to go up your index finger. And see, I'm just pressing, and then we're going to back and go back the same way we just came, with the same amount of pressure. Don't forget to get in that little area on your wrist. Just stimulate that, and the whole time you're thinking about how this is helping to move the energy and to keep everything going in your lungs. And you can take some nice deep breaths while you're doing this. And then you're going to get back into this little area. Come all the way across the clavicle. Go over to the opposite side. Now we're going to do the other arm. Whichever one you didn't do, do the other one now. Get into that soft spot. Really work it out. And then begin to pinch or to squeeze. Palm up, remember? Palm up. Come all the way down and take some nice deep breaths here and think about this. Get into this area. And work your way onto the thumb. And then up the index finger. And then back just where you came from. Just back it up. And the pressure that I'm using, I'm not using a great deal of pressure, but you know, I can feel it. I want to make sure that I'm really stimulating those lungs and helping them to stay healthy. And then just kind of squeezing on both sides. Remember, we're affecting not just the lungs, but the large intestine here. So what does the large intestine do? But that is our elimination system. So if we have any toxicity or anything build up that's in our lungs, we're going to help release that through our digestive tract and our elimination system. So now I want you to come all the way to the center where your sternum is, and you're just going to start working your way down your sternum. Just kind of, I'm really just kind of doing this, not rubbing over the skin, but I'm deeper and I can feel like the bone underneath there. Just go all the way down, and then you're going to feel where your ribs start to come out. And that's where we're going to give a little bit more effort and kind of tuck your fingers up underneath your ribs where your diaphragm is. That might be a little tender right in there, and that's okay. Don't hurt yourself. Work your way right back up again. There, doesn't that feel good? I think so. So now just kind of shake it out. And now I want to do some fascial releases and be able to really expand our lungs with our breath. So again, you can just follow along with me, but I want you to start doing some nice, big, and slow shoulder rolls. And do about 3 of them in one direction, and then reverse and do 3 of them in the other direction. That's good. And now let's get our arms involved and really open that up and go slow. And again, do about 3 one way and breathe in. And if you want to, you can tip your head back. That's going to open up this whole area because your lungs come all the way up just underneath your clavicle. That doesn't sound intuitive, does it, that our lungs are up that high? And then you're going to do it the other way. Really over-exaggerate these movements. Good. And now take a nice deep breath in and raise your arms up. And really reach and bring the arms down, and again a nice deep breath in. Tip your head back and reach for the stars. Reach, reach, reach. Good. Good. Let's do that one more time. Nice deep breath in. And reach, reach, reach. Now you're going to drop one shoulder, leaving the other arm up. And make sure that you're keeping the arm that's raised, that you're keeping that hip grounded on what you're sitting on. Don't hike up. That's cheating. Keep this level. Try to keep your pelvis level. And lean over. Oh, and kind of twist up a little bit. See if you can keep your arms straight. And reach, reach, reach. And rotate up while you're taking a nice breath in. Good. And let's take a nice deep breath in. And drop this other shoulder. Same thing over on this side. Make sure that you're keeping your pelvis grounded, your hip grounded, and twist up. And reach, 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 reach. Breathe in. Open up that whole side. Great. Let's do that another time. Nice deep breath in. And drop over and rotate and reach. Feel that expansion. And the expansion is in the back, it's in the side, it's in the front, it's up here, and it's down here. Both arms up, nice breath in, head back. And drop that shoulder and lean. Rotate up toward the ceiling. Oh, that's great. Now we're going to tuck our chin and roll our back down. And just roll down. Roll down until you feel tension. Now, this is important. You always want to listen to your body. Don't overdo anything. It isn't about how far you go. It's about you being aware of your body. And when you feel some tension, you might feel it in the back, you might feel it up in the upper back, it might be somewhere in the legs. But when you're feeling that tension, take a deep breath as if there's a balloon. Your lungs or that breath is a balloon and it's pressing out from the inside of you. It is stretching that area. Let your breath do the work for you. So tuck your chin down and slowly, gently roll as if every vertebra along your spine is opening one at a time. And then when you get to that point of tension, take a nice deep breath in and let the lungs, let your breath stretch open that area. Oftentimes that tension that you're feeling is a connective tissue called fascia. And when you want to come up, take a nice deep breath in and let the breath gently roll you up, one vertebrae at a time. You don't want to be down here and then just sit straight up. That's not what we're doing. So let's do that again. Chin to chest, roll. Nice breath here, and let the breath open up the tension areas. Every time that you do this, you might notice that you go a little bit further. And when you're ready to come up, let the breath bring you up slowly. And roll your shoulders back. And let's do that one more time. Chin to chest, gently roll down. Take a couple nice breaths here and let the breath open up any areas of tension. And when you're ready to come up, let the breath bring you up slowly. Take a nice breath in and let that breath raise you up. And then roll your shoulders back. And now we want to rotate on your pelvis. You're just going to do these circles. Just rotate around. Do this very, very slowly. Notice if there's any tension, or if you have discomfort, try to modify it a little bit. If there's no discomfort, then just make these circles as big as you can. And what that's doing is we're keeping this whole area, your whole spine, your lungs, your ribs, your back, especially as we're sitting around our house right now all the time. I'm catching myself, you know, just slumping in here like this, but we want to keep ourselves open. So I hope this was helpful for you. If you have any questions or comments, please don't hesitate to ask. My name is Lisa Scott. My website is Fresh Life Connection, and I do have some videos and stuff there that you can purchase. I am on Facebook under Fresh Life Connection, and I am on Instagram at Mama Lisa. Until another time, thank you and be well.